Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 31st of March. Let me start by saying thank you to Graham, who's done the update for the last couple of weeks whilst I've been on leave, which I must say I've enjoyed. And I think everybody needs to get some break, don't they, from the pressure that certainly this organisation has been under for pretty much the last year. Well, the last year, of course. The picture around COVID is an improving one. Today we have 4 COVID positive patients who are in our 1 COVID positive ward who are positive within the last 14 days. And if we look at other patients who are in because of COVID, there are another 26. So 10 on the hospital site, 12 in Clifton, and actually 4 patients who are in critical care because of COVID, who are more than 14 days past their COVID infection. It just is another reminder of what a serious condition this is and how long it can take to recover, even from the acute phase, if people are poorly enough and in intensive care. Having said that, our intensive care capacity, which you'll remember we escalated up to 32 beds in the height of the third wave in the middle of January, when we took over our surgical daycare unit to provide extra capacity, we're now back to our normal capacity of 16 beds, and that therefore means we've been able to reopen our theatres and are really getting back into our routine surgical work, as I'm sure everyone would hope. It's not back to full capacity because we still have to do more infection prevention and control methods, separate people, more screening and swabbing, and PPE slows the procedures down and so forth, but we are getting back as quickly as we can to normal capacity, which is good news. We've had 1 COVID death to report in the last week. So that takes the total since this time last year to 762 patients who have died within 28 days of their first COVID diagnosis. As far as the community is concerned, the numbers have stayed pretty steady for the last few weeks, and that's good news. Blackpool shows 37 per 100,000, Fylde 56 per 100,000, and Wyre 41 per 100,000. The age group really showing that for the over 60s, the number has come down fantastically. And as we've said before, an enormous part of that is to do with the successful vaccination programme. The national average, the average in England is 41 per 100,000, so Wyre is bang on that average. The Trust itself has delivered just short of 20,000 vaccinations, largely to our own NHS staff and to care home staff and to some patients over the age of 80. We're now doing a lot of second injections with that programme, but of course the big vaccination story is around vaccination centres such as the Winter Gardens and across primary care, primary and community care. The teams have done all of the care homes across the Fylde coast, and that's a fantastic effort, and great credit must be sent to those teams for delivering that. That's very high, that's very successful from a national perspective, and it makes a massive difference, and we've seen that in the patients coming into hospital. Blackpool and Fylde and Wyre do very well in terms of testing, and that has always stood us in good stead, I think, and the same applies. So if you do think you have symptoms that might be COVID, it is still really important to go and get a test. There is loads of testing capacity, and it's done by dialing 119 or going on the NHS Choices website to make an appointment. So please don't forget to do that if that situation arises, because it's a very important part still of the ongoing care strategy. I think probably the last thing I better say is about visiting. Our visiting policy is still restricted, and we are wishing to move to relax visiting policy as soon as we possibly can, if at all possible sometime next week. So I hope when I update you next week I'll be able to say that we have made some changes, but for now the visiting policy does stay restrictive and the fine detail is on our website. We know that's inconvenient and sometimes unpleasant and uncomfortable for patients and families, but I know you understand it's done in what we believe is everybody's best interest, and it is in line with national policy, but we're really hoping to ease up on that next week as another bit of getting the system back to something that feels like normal. So I think we were all feeling good about Monday coming along and the next easing of restrictions, and it's great that the community numbers have stayed okay, and it's great that our hospital numbers are low now, but of course we all need to remain vigilant. So the message is still the same about being careful around the hands, face and space messages, but I think fresh air comes into this place, and being able to get outside in the fresh air and move around is a very healthy thing to do, and to allow fresh air through our homes and if at all possible through our hospital, for example, is a positive thing. So there's a bit of common sense in this, isn't there, about getting out as much as possible, getting some fresh air and some exercise whilst remaining safe and vigilant. Thank you very much.